Welcome to Save As Ability, a podcast to educate and inform you about disability employment issues. My name is David D'Arcangelo, and I'm your disability policy expert.
Welcome back for another episode of Save As Ability. It's David D'Arcangelo. We appreciate you. If you could help us continue to grow, share, subscribe, like, comment, all that stuff really does help us get our message out and keep great content flowing for you. So today we're talking about something that I've experienced as personally and professionally trying to work with people with disabilities and their families. And it's not going away. As a matter of fact, it's getting worse. And that is the shortage of direct support workers and home health care aides, particularly for people with disabilities. So we're going to talk about that today. Okay, we'll get right into it. And really, there's a big need out there. So there's a need for all individuals, but particularly a large amount of individuals that are going to need these services are people with disabilities. So, if we use the American Community Survey number, somewhere around 42 million Americans are individuals with disabilities, okay? And a large amount of them are older individuals, right, that are aging into disability. And let's look at waitlists, for example. We have good, hard data on that. That's not, just from some group or something. This is from Medicaid. The Medicaid HCBS waitlist right now is somewhere around 700,000 people. Okay. So that means there's 700,000 people out there waiting for a direct service provider or home health care to be able to come and help them with basic needs here. Okay. So this is a crisis. This is a major issue for hundreds of thousands of Americans out there. And with the population aging and more people living longer, this isn't going away anytime soon. All right. So there's a huge workforce crisis of home health aides and DSPs. Okay. And one of the main things driving that is low pay. Right now, according to the Bureau of Labor Statistics, the average wage that a direct service professional makes is somewhere around $15 an hour. Okay. $15 to $16 an hour. This pay is so low that how are you going to retain talent? And what you end up seeing is turnover rates at around 40% annually. All right. And now it's turnover for two different reasons. One, because of the low pay. Two, though, because the nature of the job is very challenging. And, there's huge burnout. And one of the trade industry groups out there, ANCOR, keeps data on this. And that's the Association of all of the human service professionals. And it indicates that producing instability is an enormous challenge and there are hidden costs to it. So what we're finding is that not only is it the cost of getting the direct service workers paid and everything, but then because there's such churn, because there's such turnover, that's then costing even more, costing the organizations even more, and really ultimately the taxpayers, because so much of this is funded either from the federal government or the state government or some combination thereof. Okay, so these low wages really are a symptom of suppressed Medicaid reimbursement rates, which, really haven't kept up with the times. And that's not necessarily the answer, by the way, though. For anybody out there saying, well, the government needs to fund more. We funded more and that hasn't helped. So I don't think that that's necessarily the answer. Is it a piece of it? Probably. But there's a way where we can do this better. And what I would assert, it's to open up the free market. Because there's really what's happened with Obamacare and all of these large government programs, particularly on the federal level, but also on the state level, is what they've done is they've distorted the market. And the market has become so overly reliant on these public benefit programs that the caregiver market doesn't really reflect what could actually be there. Okay. So to me, the way to address this is reduce barriers for the entry of new private sector providers and make more of this a private pay model, okay? Because that will end up doing three things. One, most importantly, it will get the care to people with disabilities. Two, though, this is like a jobs program. I view this as like the GI Bill for Medicaid. Like, think of the millions of people that we could put back to work if we put a good wage out there with good terms and good value there. For example, if we created a pool of these DSPs and home health care workers that they could get insurance, not government subsidized insurance, but employer paid insurance. All right. Travel reimbursements, all of the other incentives that we could be in place, like a free market system offers, that would be a huge removal of a barrier. You would get hundreds of thousands of workers back into that space, which would raise wages for those workers. But because what happens? Well, when there's competition, that raises the wages, and that's a good thing, because now all of a sudden the people who need the services have more choice. They're getting better services. It's a win-win. So to me, what is happening right now, we've got to get away from this over-reliance on these public benefit program models. They're not working. If they were working, we wouldn't have these shortages, okay? So the market has been totally changed because of that. So let's go back to the free market. That's my first thing. Second thing is we've got to innovate with technology here. Now there's so many things that can be done for smart home devices and for the manner with which, so that's actually giving the services, but also the behind the scenes, the administrative, and all of the time that can be freed up. Like, why are we getting these insurance companies involved and Medicare and Medicaid involved? Like, that paperwork is just too burdensome. That red tape takes up too much time. Let's be paying these workers to actually give care rather than filling out paperwork and be worried about all these other bureaucracies. All right? The impact on the families in the economy would be so positive. This would be an economic driver, which again is going to support care. That's the thing. This is, when done well, this is a win-win-win. You're going to help the people with disabilities by getting them better care. You're going to help the worker because they're going to have more jobs and better wages. And ultimately, you're going to help the taxpayer because you're not using all of these inefficient public funds to fund the thing. All right. So we can do it. We can fill the gap. And there's more than 50 million Americans out there with that are potentially exposed to this in some way, either as the worker or as the person that needs the services. So, don't believe me. AARP did a study right there of what this could mean on the U.S. workforce. They're not exactly a right-wing think tank, by the way. So if they're pointing towards market-driven solutions, it's time to modernize these systems. Again, my idea is let's have like a GI Bill for home healthcare workers and direct support professionals. Put it in for private enterprise. That will be a win-win-win. I just know it. So it's a crisis now. We've got to address this. I care about Americans and people with disabilities. We're going to fix this, okay? So, but you've got to get involved, get activated. Let me know, all right? So to sum up here, the free market path forward will help encourage private capital into this arena, which will lead to jobs, which will lead to increased wages, which will lead to better care for our Americans, in particular our Americans with disabilities who really rely upon these services. So it's a major issue. It's not going away, but we got solutions here at Save Visibility. It's David Darkangelo, another episode. I hope you have a great day.
For more information about disability employment issues, please visit our website, disabilityemploymentsolutions.com. The Save As Ability podcast is available on Apple Podcasts, Spotify, our YouTube channel at Disability Policy Expert, or wherever you stream your podcasts. Subscribe, stream, rate, and review our shows. Your ratings and reviews help our show reach new audiences. Produced by Pod Pro Entertainment. Save As Ability lives within a network of podcasts located at podproentertainment.com. #The New Radio. Again, my name is David D'Arcangelo, and I'm your disability policy expert. Until next time, thank you. I hope you have a great day.